So let's talk a little bit about the killed virus that is mandatory in every state, rabies virus.
Rabies.
And let's talk about why some states there have a 1-year option and a 3-year option.
Right.
Some of my clients erroneously think that the 3-year vaccine is 3 times stronger.
Mm-hmm.
Some people think it's 3 times as much volume. Some
Right.
people think that it's been researched 3 times longer. If you could shed a little bit of light on what's really going on, that would be excellent.
Okay, now rabies is a really good example of a non-infectious vaccine. Now, prior to the mid-'80s, all of our canine and feline rabies vaccines were modified live. So 1 dose was adequate to immunize, and you generally gave that dose at 12 weeks of age or older when there was no maternally derived antibody to interfere. In those days, with the modified live, you then would revaccinate each year because they didn't know whether or not the immunity was longer than that. Well, in the late 70s and early 80s, we had an episode occur in this country where some kittens being vaccinated in California came down with rabies. And that caused USDA to rethink the approval of a modified live rabies vaccine. Now, this may have actually been not the vaccine becoming virulent, but those kittens could very well have been severely immune suppressed. They could have actually been infected with feline leukemia virus and or feline immune deficiency virus. And that's why they came down with rabies. But obviously, when that happened, it was decided that modified live or infectious rabies would no longer be allowed, and we then started switching entirely over to a non-infectious killed inactivated rabies product. We never did change the vaccination program. We changed the vaccine, but not the program. And my recommendations actually back in 1976, which I published then, and in 77 and 78, when we switched from a modified live rabies vaccine to an inactivated vaccine, we should give 2 doses 2 to 4 weeks apart and then revaccinate in a year. But we didn't. Fortunately, the rabies glycoprotein antigen in the killed vaccine is a very powerful antigen, and they had to add something to that vaccine, which you generally have to add to most inactivated vaccines, called an adjuvant. And an adjuvant is a very strong immunostimulant which provided enough stimulation to that glycoprotein to allow that 1 dose of vaccine to stimulate in a majority, not in all, but in a majority of dogs and kittens, a protective response until another dose could be given a year later. Now, generally, when you go much beyond about 6 to 8 weeks between the 2 doses, you'll have no immunity at all. For example, any of you who might use a lepto product, you would never go beyond 6 weeks between the 2 doses because you wouldn't have any immunity at all. That's a very weak antigen compared to rabies.
So back to antigens.
Mm-hmm.
What is added? Could you go over the antigenics, the antigens that are added to veterinary vaccines? Some of the antigens that have been included in human vaccines, like the thimerosal, have been, they have removed them from the vaccines, but that hasn't been the case in veterinary medicine.
Okay, so there's a number of different things added to various vaccines. One is a preservative, and the thimerosal, which contains mercury, is a very effective preservative. and that has been added to human vaccines for many, many years.
Yep.
It's one of the most effective preservatives. We haven't had thimerosal added to very many veterinary vaccines at any point. We do have other preservatives, but that was one that really wasn't used widely like it was in human medicine. Now, the thimerosal has become very much of a concern because mercury, being one of a number of heavy metals, does have the potential to cause adverse reactions. And it can be very toxic at high levels and neurotoxic in the case of mercury at high levels. So it's one of the things that they have made an effort in human medicine to get it out of all vaccines or to reduce it significantly. And right now, most human vaccines no longer contain that particular preservative, contain another preservative. In veterinary vaccines, I'm not aware of any of them containing thimerosal because we didn't have that many in the first place.
And aluminum?
And aluminum was part of, and it's still the most common part of human adjuvants, because alum is the adjuvant that's added, and it's the only one approved for human vaccines. Again, we have veterinary vaccines that have alum or aluminum in, but we have many other adjuvants in veterinary medicine. Veterinary medicine actually has always been far ahead of the vaccine curve than human medicine. We have vaccines using new technology that have been improved in veterinary medicine, and it's still not approved in human medicine.
There's a lot more research.
There's a great deal more research that we can apply to veterinary vaccines. It's not that they're not doing that research for human vaccines, it's just that they're very slow to apply it. They can't get approval for a lot of new technologies and new adjuvants and so forth as quickly as we can in veterinary medicine. The other advantage we have in veterinary medicine, which is very critical, and I hope as pet owners you understand how important this is to your pet, and that is the ability for us to do animal studies on a target species. So if I want to develop a new vaccine or drug for dogs, I want to do that work in dogs. I don't want to do it in rodents, which is what you have to do for human vaccines until you can actually take it to a clinical trial. But it takes a long time to get there. It's one of the reasons that we can move more quickly in veterinary medicine, and I think we can also make a better product because we can test it on 10 beagles. So we don't have to test it on someone's poodle. And
So then back to the adjuvant question. We see vaccine reactions in veterinary medicine. We see pets die from vaccines in veterinary medicine. We see long-term, you know, there are 4 different types of allergic reactions. We can see anaphylaxis. We can see a secondary
autoimmune disease,
and then long-term progressive degenerative autoimmune diseases. Does it feel to you? First of all, are you able to correlate, like many practicing veterinarians are, the correlation between over-vaccination and autoimmune and an increase in autoimmune conditions in pets?
Well, I think there's no question in both pets and humans, autoimmunity is more prevalent today than it was 20 years ago, than it was 40 years ago. And I think there are multiple reasons for that. Without question, vaccines would be one of those reasons. But also there are many intoxicants, there are many environmental pollutants, there are many chemicals.
Metals.
And and so there are a lot of factors in the environment that in what generally is a genetically predisposed individual, and that's the important thing, for example, about immune-mediated or hypersensitivity type diseases. Genetics plays such a key role. these other factors are triggers to cause in a genetically predisposed individual these immune-mediated diseases. And it can be natural infection, it can be vaccines, and it can be all those other factors. And so, yes, we are seeing more of it,
Absolutely.
and in all of the species.
Yep. So if you have pets that have either had vaccine reaction, what's your recommendation? I mean, in my practice, if you have an animal that has had vaccine reaction, first of all, we have a very minimalistic vaccine protocol. We do titer to make sure that it's
Right.
been effective. But if we've had animals that have had vaccine reaction, it would be out of the question for me to continue to vaccinate the pet. I simply wouldn't do it.
That's absolutely the approach that everyone should take.
Yes.
Now, if it's an adverse reaction to a core vaccine and you've already immunized, what you should be doing is a titer. And if there is any titer measurable, don't
Right.
give that particular
Right.
product again. If there isn't, you're going to almost be obligated to make sure the animal is protected against those core diseases because they are so deadly and it's so important to have immunity. And you have a few options. You can pre-treat the animal depending on what the reaction is, but that will be no assurance that they won't have
Right.
another adverse reaction.
Right.
You can switch products to another product and hope that it was something within that product, that specific product you used initially. But that also won't guarantee you won't have a reaction because the animal may, for example, be hypersensitive to bovine serum albumin, which would very likely
Right.
be in any
Sure.
manufacturer's product.
And really, being that the risk versus benefits, the risk would be high enough. Certainly, that would be something that I wouldn't feel comfortable doing in terms of revaccinating a patient that has had a reaction because the potential's there for a more significant reaction to occur.
Correct,
Certainly.
yes.
Now, back to the 1 year, 3 year rabies.
Let me get
Okay,
back to
yes.
that particular question. We want to make sure the animal is immune to the core products. Now, if that adverse reaction was to a non-core product, an optional product, which they very often are.
Of course.
Quite honestly, the core vaccines are far safer than the non-core in terms of adverse reaction.
Yes, we'll talk about why in a minute.
My
Yes.
response is always forget about
Yep.
that particular vaccine. If it happened to be lepto, or if it happened to be Lyme,
Right.
or if it was injectable Bordetella, don't even think about giving it again.
Right, right. And that to me would be a common sense approach. That if you've had a patient have a significant reaction to a vaccine that your veterinarian is encouraging you to get, let's say for protection against lepto, that would be something we would just tell you to not, or Lyme vaccine.
Right.
Simply don't continue giving those injections. It would seem counterintuitive to do so.